Welcome back to the morning show here on Arise News. Colorectal cancer, which has been on a rapid rise among Nigerians, used to be regarded as a Western disease. However, with change in dietary habits, greater numbers of sufferers are now being detected. The good thing is that the cure rate after detection has been impressive. For men who are up to 45 years and older, doctors are recommending regular screening, colonoscopy for bowel cancer. According to them, this screening is not radically different from mammogram for breast cancer and pap smear for cervical cancer. Well, for greater insight, we are now being joined by Dr. Owen Woghiren, a consultant physician and gastroenterologist. Good morning, doctor. Good to have you join us on the morning show.
Good morning. Thanks for inviting me onto the show.
All right. High-sounding words this morning. How bad is the disease we are talking about? I mean, this is almost like men talk, but then colonoscopy is gaining a lot of attention in Nigeria, and you are trying to basically say that once you are more than 45 years for a man, be watchful. Where are we in terms of awareness, in terms of people responding to the sort of call that doctors like yourselves are making to Nigerians?
Okay, there has been an exponential growth in colonoscopy or endoscopy as a whole in Nigeria. A few years ago, let's say 10, 20 years ago, there wasn't very much endoscopy taking place in Nigeria, but there's increased awareness and there's a lot of centers now doing endoscopy. So colonoscopy is widely available in most parts of Nigeria, and I'm pleased to hear that because it means we have this screening tool, which is very important for detecting colorectal cancer, not just in men, also in women.
Oh, okay. It's not just a men thing?
No. So men have a higher incidence of colorectal cancer, but you do find colorectal cancer in women as well.
So colorectal cancer has definitely seen a significant rise in Nigeria in recent years. But what I want to ask you is, the cure for this type of cancer is impressive when detected early. So can you elaborate first off on the importance of early detection, but also can you explain exactly how it works and why colonoscopy is considered a valuable screening tool?
That's very correct. So the gold standard for detecting colorectal cancer is a colonoscopy. And if you do a colonoscopy early, let's say around the age of 45 for men, then
and what age for women?
45, so it's roughly the same age. Okay. So I would tend to talk about colorectal cancer as something that affects both men and women.
Right.
So if you did that test early, then your chances of detecting early colorectal cancer is much higher. And the cure rate for colorectal cancer, if it's a stage 1 disease, is actually about 95%, a 5-year survival. So it's very good, it's impressive.
Mm. Okay, talk to us about the dietary habits that seems to be contributing to all this. What are we not eating right? What are we eating that is aiding exposure to this sort of a thing? I
think there's what they call the red meat hypothesis, where we eat a lot of red meat, okay? We don't eat naturally, we don't eat healthy foods, lots of beef, red meat, very low fiber, those sorts of things, and too much alcohol as well. So there are other factors that actually contribute to your increased risk of colorectal cancer. And also there's a family risk as well. So, colorectal cancer can run in some families, and it's advocated those families that have, yes, they should actually have regular screening at an early age as well.
Okay, so when we talk about the colorectal cancer screening, especially with focus on colonoscopy, there's a misconception as to, people are kind of afraid to do it because of what it involves. What would you say to address these concerns and emphasize the importance of such a screening?
Okay, it's understood that a colonoscopy is an invasive test, and nobody likes to be poked around with a tube. But it's an important tool in detecting and prolonging your lifespan. So we do a lot of colonoscopies, and they're very safe tests. The risk of you having any complications is very small. And we give you sedation, we give you painkillers, and make it a lot easier for you to have the test, as if you didn't have anything at all. So as somebody who does a lot of colonoscopy, I would try and reassure the public that in the hands of an experienced operator, a colonoscopy is a safe test. There can be some discomfort, but we can always take care of that with the sedation and the painkillers we give you. And we're getting better at it as well.
Okay. So for men 45 and above, how regular will they need to carry out this sort of test?
The recommendation is you should have your first colonoscopy around the age of 45. Okay. If there are no findings at all, the next colonoscopy should be at the 5-year point. But if you do find anything significant like a polyp, which is a precancerous growth that can lead to cancer, then you should have another one rather sooner than 5 years. It depends on what kind of findings during the test.
Well, what are there any signs or symptoms that an individual that may have this type of cancer should be aware of, and when they seek why and how soon should they seek medical attention once they begin to see these symptoms?
So they're what we call red flag symptoms. So it's very important to understand what they are. So things like bleeding from the back passage. Okay, seeing blood in your toilet is not a good sign at all. Losing weight, feeling tired all the time, having what we call a change in your bowel habit from normal. So if you've noticed a change in your bowel habit, then you're seeing blood and you're losing weight. Those are 3 red flag symptoms you shouldn't ignore. So the answer to that question is you should seek medical attention as soon as possible because the symptoms are not going to go away.
What is the data saying as to the prevalence of colorectal cancer in Nigeria? Is this something that should worry anyone? We
don't really have national statistics for colorectal cancer in Nigeria, but if I speak to my colleagues and myself as well, thinking back, looking at the data that I have from my personal experience, it's actually an increase in it's actually out there, colorectal cancer. We're seeing more cases. And the important thing to remember is in Nigeria, we're seeing people presenting at a very late stage. Though, on the other hand, I'm pleased to see that lots of people are coming forward and having screening colonoscopies. So in the last week or so I've been in Nigeria, I've done quite a lot of screening colonoscopies. So people are actually aware and coming forward to have colonoscopies done. And not just people who are coming into the country having them abroad, people are now having them in Nigeria, which is actually quite a good development.
Is this something that practically anybody can afford?
So that's one of the big things about endoscopy and healthcare in general. Healthcare is expensive, and that's something we need to understand. All the equipment we use for colonoscopy is imported. We pay dollar prices for it, but we are trying to mitigate costs by choosing our patients carefully, and sometimes we offer people other tests if they're not able to afford a colonoscopy. So there's something called the FIT test, which is a stool test. It's a simple, easy test to do. And if you're asking the question, should I have a colonoscopy or not? We do a FIT test, and if it's positive, then you're more likely to have, a problem there, and we say you really need to have a colonoscopy.
All right, then you had earlier mentioned how it could even be genetic. If you have like a family member that might have had it in the past. So I'm trying to understand exactly what role genetics plays in this colorectal cancer risk, and should individuals with a family history of the disease consider an earlier or maybe say frequent screenings? Because I know we were talking about the age of 45, but if you know someone in your family that has it, is that maybe a reason to go in earlier or take frequent tests?
That is correct. So if you have a family member with a colorectal cancer, I'm talking about a first-degree family member, then you're more likely to have colorectal cancer. So they say your risk goes from 1 in 200 or 1 in 250 to 1 in 50 of the chance of having colorectal cancer. So what we normally do is we take 10 years from the first person who had it and screen from then. So if you had somebody in your family who had colorectal cancer at the age of 45, then your first colonoscopy should be done around the age of 35. But sometimes you might have to do it sooner if there's what we call polyp syndromes, where you have lots of factors, like lots of polyps in the colon that predispose you to having colorectal cancer.
So early detection is, of course, advisable, is key.
Yes, yeah.
But then if those who come late and they are probably predisposed to it, is it a death sentence, colorectal cancer?
It depends on the stage of the cancer. So, even with people with stage 4 cancer, they can still prolong their life as much as possible. They say the survival rate, the 5-year survival rate, which is the way we look at it, is still about 30%. So depending on what kind of treatment you've had and the location of the cancer as well.
Well, I mean, even from just listening to you talk, you said you've not been in Nigeria long, but I want to know what your insights are to the current state of colorectal cancer awareness and prevention efforts in Nigeria as of now. What steps do you think that we can take to further promote awareness and early detection?
So I think publicity awareness is very important. If people don't know about colorectal cancer, they won't think about it. So I think there's quite a lot of wellness programs in Nigeria. A lot of hospitals have this wellness screening. And I think a colorectal screen is also part of that, should be part of it. If you're going to have your yearly checks, then you should have a yearly fit test. If you haven't had a colonoscopy, then you should have a colonoscopy. So the colon is also part of your body. It's not just about your heart, your liver and your lungs.
Mm. All right, Dr. Owen Woghiren, we want to thank you for joining us on the morning show today. I mean, it's been enlightening for the short period.
Here.
Absolutely.
Thank you very much for having me.
Thank you very much.